Thank you very much, Owain. Bore da. Good morning, everybody. Lovely to see so many of you here. This is, I think, the 9th Health and Care Research Wales Conference. I've been to many of them in the past. This is, as Owain was alluding, certainly you are the biggest, most beautiful crowd we've ever had. But I'm sounding like Donald Trump, so I'll stop that now. It's a really important opportunity for the research community in Wales to come together, to share ideas. It's really important we do that, to share best practice, but also to celebrate the achievements that we've made over the last year and to look forward to the year ahead. So I hope we'll manage to do all of that today. I'm sure you're going to find the event informative, interesting and thought-provoking. Of course, there have been some changes recently in Welsh Government, in the leadership. I sometimes think of it as musical chairs for politicians, but it's not quite as frenetic as it's been sometimes across the border in England. But we do have a new Health and Care Minister, Jeremy Miles. He's the Cabinet Secretary for Health. And we're very fortunate, actually, that our former Cabinet Secretary, Eleanor Morgan, has become, of course, as we know, the First Minister. So she has a deep understanding of health. And I think that really is to our strength, that our ministers and our First Minister understand the importance of research and development and health in general. In fact, the First Minister has made health and well-being one of her top 4 priorities. Iechyd she frames it as. So that's really positive. We do have an overarching health strategy here in Wales. Obviously, we're looking at what's happening across in England in terms of the Darcy review, but we do have a Healthier Wales as our overarching strategy. We're currently going through a refresh of that, and some of the elements of that refresh will be to strengthen the prevention element, a matter very important to me as a public health physician, to really focus on our digital, because we've fallen behind on some of our digital work here in Wales, but also to promote a stronger emphasis on innovation and research. So those themes will come out very strongly, I think, as we refresh our strategy. I don't think I need to remind anybody here, but I will, of the benefits of research and development, and why we invest in research and development here in Wales and across the UK. The obvious point is that there's an economic benefit. When I was looking at the figures recently, I've got some later maybe, but roughly from what we invest in research and development here in Wales through Welsh Government, we get about a 3-to-1 return on investment in terms of other grants from outside being brought in. So there's an economic benefit and a jobs benefit, because some of that money helps to drive jobs. So that's really important for us here in Wales. Secondly, of course, there's a real impact on the workforce that we have here in Wales. Engaging in research makes jobs more interesting, more rewarding, and we know we can attract people into Wales. So we need to do that to bring the best, the brightest people here into Wales. So there's a workforce benefit, and of course at the bottom of it, at the end of the day, we need to think about the patient benefit, because the patient benefits are huge in terms of earlier diagnosis, access to quicker treatments, to more modern treatments, to more effective treatments, improvements to our health systems and the way our health system works. And it's clearly evident time after time that mortality of patients is reduced when we have research active hospitals. So those 3 benefits are something that we really need to keep in mind. Now, we do have a Research Matters, our plan for research in Wales, for continuing to improve the health and care research that we do. A huge amount of work has gone on to develop that, and I'm very pleased to see that is coming to fruition. We do have an annual report, which I think is being launched today, actually, for 2023-24, and that, of course, has been endorsed by our new Cabinet Secretary. So I don't know if we have copies of that, but I guess they're online, and we can make sure people have access to all of that. I want to just reflect briefly on some of the successes and the achievements of the last year since we met in Swansea. And the first one I want to talk about is the funded schemes that we support here in Wales. That has led to a really significant increase in access to NIHR funding schemes. I think that's really important because that's how we attract in resource from elsewhere. The challenge with that, of course, is that we have to seize the opportunities. We have to make sure that we have high-quality bids going into NIHR and the NIHR-funded schemes. And this runs alongside our own investments, of course, where we've invested over 5 million. I think it was mentioned on the slide, on the video just there, that we've invested that in research capacity, research capability through our universities, the NHS, and now, of course, in social care. So the funded schemes are a clear success of last year. The faculty was mentioned on the video as well. It's 2 years since we set up the faculty, and I think we have now 217 members of faculty from, again, across health and across social care. People from all backgrounds, all stages of their careers. And this is really important to us because we need to continue our work of developing the leaders, the research leaders that we have in Wales. We've got to invest in our current research leaders, but also bring on the next generation, exactly as the video was saying. The future generation of researchers is very important to us. The third thing I wanted to mention was the funded centres, the centres that we support through Health and Care Research Wales. And some of the successes that have come from those funded centres. I think in terms of the grant input, we've brought in about 45 million pounds of external grant funding, that economic success I was talking about, which is so important. 120 odd grants have been won, 250 jobs created, and numerous publications. So this is really a strength to us here in Wales. And I think we've mentioned that CARE, our Centre for Adult Social Care Research, is now established based at Cardiff University, and that's really important because we need to influence the social care policy here in Wales, but also beyond Wales. We need this to be a centre of excellence which can help to develop social care research, which will inform policy across the borders in the other developed nations. I'm very grateful to colleagues. I'm sure we have colleagues here from Cancer Research UK, and we've developed adult and paediatric cancer centres, the experimental medicine research centres, a very important new development here. And I think there's already been mention of the evidence centre, the Health and Care Research Evidence Centre, which grew out of the COVID Evidence Centre that we set up during the pandemic, and that's a really successful, I think, piece of our architecture, helping to synthesize evidence so that we can develop it and move it into policy. The fourth thing to mention in terms of success is our research delivery. I've already talked about some of the grants we've obtained, but over 20,000 people, participants, patients here in Wales have been recruited into high-quality research projects, research studies, and this is helping to develop cutting-edge therapies, treatments, medications, etc. That research matters framework that we talked about is very important to us because it would help us to embed into the culture of the NHS, the research and development. And I've been very keen that we make sure that all of our health boards have a research element. They're all university health boards and they all have research interests, but strengthening that through the R&D directors within the NHS bodies is really important. Just to mention Susan Rankin, who's one of our chief executives, actually of Cardiff and Vale University, University Hospital Board. She's our NHS R&D champion from the CEO. I don't know if Suzanne's here today, but she'll wave if she isn't. She's probably listening online. The fifth thing to mention is our relationships with industry, which I think are not as deep or as wide as they need to be. I think we are making improvements. We have made some improvements. We've got key links here. We're not the golden triangle, let's be honest, but we do need to try harder with our work with industry. There are some examples of good practice. So we've partnered with BioNTech and Moderna on some of the vaccine work, along with other colleagues in other nations of the UK. We have attracted some funding through the Voluntary Pricing Access and Growth Fund, which brings in funding from the pharmaceutical, with requirements and expectations from the pharmaceutical world that we will deliver on the agenda of research that they want to see supported to develop new medications. So our work with industry has been a success, but we need to do more, I believe, than we have. So that's looking back, but I said today is also about looking forwards. It's really important we do that. And there's three things I'd want to just kind of flag as we move into the next phase of our work, really. The first one is that we in Wales are very proud of the fact that we do work in a very multidisciplinary way. So that priority project, which has been championed by our Chief Nursing Officer, Sue Tranker, and our Chief Therapies Advisor, that really is quite important to bring research into nursing, into midwifery, and to make sure that they're fully participating. Similarly, we've got a healthcare scientist research and innovation strategy to bring in folks from healthcare science and the pharmacy community as well. Second thing, we need to play to our strengths in Wales. We can't afford to do everything and have a scattergun approach. So there are some things which we need to, we do excel at, we need to really double down on. And I look at genomics, at the links with SAIL, some of our digital work is, through Digital Healthcare Wales, Health and Care Wales, as things that we need to really focus on. And the third big thing for the future, I think, is to really double down on our equality and inclusion agenda to make sure that we're really reaching communities that sometimes we struggle to reach. And as part of that, making sure that our public engagement is as robust and as transformative as it needs to be. So those are the three things I think we need to think about going forwards. So in conclusion, with a red flag being waved at me, well, two things to say. One is thanks to everyone in this room, because you are the people that make the research happen, that drive this forwards. And I'm very grateful to all of you for the work that you do. You're helping to embed clinical research in the NHS. That's really important. You're making participation as easy as possible, and you're helping staff to feel empowered to engage in research. So thank you to all of you. And the very final thing I need to say is to mention Kieran Walsh, who has been our Director of Research and Director of Health and Care Research Wales for the last 5 years. I can't believe it's 5 years, Kieran, that you've been with us. Kieran has been absolutely... I've learned a lot from Kieran about the research and development agenda. He's helped us to get much stronger links into the UK architecture than we had 5 years ago. So I'm very grateful to him for that. And I've seen him work with successive ministers to remind them of all the things I just said about the benefits of research and why we invest in research. It's been a Sisyphean task because the ministers change, and I've seen Kieran kind of persuade them, and then the ball rolls back down the hill and he starts all over again. We're going to miss you, Kieran, but thank you for everything you've done. And can we give Kieran a round of applause? Diolch yn fawr.